Progress in primary biliary cholangitis. Definition: PBC is a chronic autoimmune disease electively affecting interlobular bile ducts cholangitis, leading to the rotation of bile salts into the liver, cholestasis, and secondary damage of hepatocytes. The onset is often silent and insidious, but the disease may progress towards cirrhosis, liver failure, and death.
Primary biliary cholangitis and cirrhosis, sometimes just shortened to PBC, is this autoimmune disease where the T cells attack the cells that line the smaller sized bile ducts in the liver. As the cells are damaged or destroyed by immune attack, they start letting bile leak through their tight junctions and into the interstitial space, where it can get into the blood and other liver cells. This can cause inflammation and symptoms that are similar to cholestasis and obstructive jaundice, both of which there's this disturbance in bile flow.
Applications in medicine. This treatment will help people who have these autoimmune hepatic disorders, and if they are diagnosed early, it can be made to evolve slowly.
It's amazing what a Barbie doll can do.
For Lenny Moore, Barbie dolls
Isn't she beautiful?
are a welcome escape from a devastating diagnosis that's left her tired and itching all the time.
I itch so bad that at times it feels like little bugs are crawling on you.
First diagnosed with primary biliary cirrhosis, or PBC, 20 years ago, she was told to prepare for a liver transplant.
And I have a son that had just gone into high school that I was worried about being without a mother.
Dr. John Vierling says most patients take a daily dose of urso, a bile acid that improves the liver's ability to function. But not everyone responds. Now there's a new treatment known as obeticholic acid that could help.
We're going to have a therapy where we can really prevent the progression of this disease.
It's the first new therapy in 20 years being tested in a phase 2 trial.
Everything that pertained to liver tests and function improved.
Welcome news for Lenny
PBC is not a death sentence.
and the more than 3,000 members of the support group she started. I'm Marty Salt reporting.
Regular website.
Pro and cons. Pros. Choice method in a study of bile ducts. Second, biliary pathology. Sensitivity 98% to 100%. Specificity 89% to 100%. Number 3, therapeutic biliary drainage. Cons: first, invasive. Second, complication 5%. 3, high price.
I'm with Dr. Keith Linder today. He is the chair of the writing committee for the AASLD Primary Biliary Cholangitis Practice Guidance. Dr. Linder, thanks so much for being here with us today.
Sure.
So tell me a little bit about these new guidelines. I understand they have not been updated in a while, and it's been really, the first update in 10 years?
Yeah. So the last update was 2009, and since that time, the biggest change has been obeticholic acid, OCA, approved by the FDA as typically second-line therapy for PBC patients with a suboptimal response to ursodeoxycholic acid in about 2016. So this was new, and it's been an important advance in the fields. First, we now have 2 FDA-approved therapies. Previously, we hadn't had any for many, many years, so we really thought this was timely to update the readers about this.
Well, tell us a little bit about the name change. I know that's been something that's been done for a while, but for those of us who are not hepatologists, it's a little surprising.
Well, one of the things that happened really was that patients were feeling discriminated against because of the term cirrhosis in primary biliary cirrhosis. It used to be more common to people that had cirrhosis on biopsy, but with earlier detection of the disease, only a minority of people had cirrhosis, and particularly in the UK, United Kingdom, people were being discriminated against when they had a diagnosis of primary biliary cirrhosis. They were having trouble getting life insurance, having trouble getting mortgages, and really it was focused on the term cirrhosis, which was really a misnomer anyway. And so, led by the patients, the scientific community got together, and around that time, there was really an international collaboration to change the name to primary biliary cholangitis. There was debate. We wanted to keep PBC, that's what we usually use, so a lot of consensus about that. Biliary cholangitis, they're a little bit redundant, but it made enough sense, and it kept the initials. So, and I think it's been really well accepted. I see it almost universally used at this point. So I think it's been a nice change, and I think it was a good message for us to see how important the patient's voice was in some of the decisions we make.
Well, that's very interesting. I think it's always great to go right back to the patient, no matter what the issue may be. Let me ask you, what do you want the rank and file hepatologist to know about these guidelines as a take-home message here from the meeting?
Well, I think one of the most important things comes from work that we've done in conjunction with people at Henry Ford. And using a large database, we have found that only about 70% of patients who would have evidence of PBC on blood tests have a diagnosis made and are treated. So I think that we as a community need to do a better job of identifying patients with the disease and then instituting treatment. We're fortunate that we've got 2 really good treatments that we can offer, but if we don't think about it, the poor patients don't get a chance to get the drug. So that would be the main thing. It's just we've tried to make it straightforward in how to make the diagnosis. We no longer typically require a liver biopsy. So the diagnosis is straightforward, and the treatments are oral and usually well tolerated. So that would be the main thing I'd like people to think about. Think about the disease, think about initiating treatment.
Well, thanks so much for being with us on the show today. It's always great to see you. I know that you've been a past president of the association, and everyone's grateful for your service.
Thank you.
Issue applied in Ecuador. The frequency of liver cirrhosis in patients with was 7.8%. The most affected gender was male, 59%. Age mean presentation was 51 plus minus 14 years. The majority of patients, 54%, came from central department and was married, 52%. The most common reasons for consultation was the control of cirrhosis, already now followed by the jaundice. The most frequent etiology was not alcohol consumption. Conclusion. The progress in primary biliary cholangitis is a chronic liver disease characterized by the inflammation and progressive destruction of the interlobular bile ducts, causing cholangitis, cirrhosis, and terminal liver disease in untreated patients for the participation of immunological mechanisms in tissue destructions.
Primary biliary cholangitis, known as primary biliary cirrhosis until 2015. Etiology not fully understood, although it is thought to be an autoimmune condition. Mechanism: chronic inflammatory process, damage to interlobular bile ducts, cholestasis and AMP. Cirrhosis. Female-male ratio, 9:1. Classic presentation: itching in a middle-aged woman. Associations. Sjogren's syndrome, seen in up to 80% of patients. Rheumatoid arthritis. Systemic sclerosis. Thyroid disease. Clinical features. Early, may be asymptomatic, or fatigue, pruritus. Cholestatic jaundice. Hyperpigmentation, especially over pressure points. Xanthelasmas, xanthometer. Also, clubbing, hepatosplenomegaly. Fat malabsorption, leading to deficiency of the vitamins A, D, K, hence osteomalacia, and also bruising. Back pain due to osteomalacia resulting from malabsorption or osteoporosis, hepatic osteodystrophy. Late, may progress to liver failure. Diagnosis. Antimitochondrial antibodies M2 subtype are present in 98% of patients, and are highly specific. Targeted against pyruvate dehydrogenase. Pyruvate dehydrogenase is found in the mitochondria, required for the generation of acetyl-CoA from pyruvate, for entry into the tricarboxylic acid cycle. Smooth muscle antibodies in 30% of patients. Raised serum IgM. Liver function tests correlate poorly with histology in primary biliary cholangitis. The disease may progress insidiously with normal or near normal liver function tests. Management. Pruritus, cholestyramine. Fat-soluble vitamin supplementation. Ursodeoxycholic acid delays the need for liver transplantation. The effectiveness of ursodeoxycholic acid is monitored by improvements in alkaline phosphatase and gamma-glutamyl transferase, but alkaline phosphatase is more widely used than gamma-glutamyl transferase. Liver transplantation has a good prognosis, 90 to 95% survival. Recurrence in graft can occur, but is not usually a problem.
Thank you for watching. New videos are uploaded regularly. Don't miss them. Click the subscribe button below and get the new videos easily.